Central Illinois' Ag Station, and that includes providing farmers information on how the commodity markets close each day and week. I'm Todd Gleason from Illinois Public Media, University of Illinois Extension, inviting you to hear the daily closing market report weekday afternoons at 5:06, and on Saturdays, tune in for Commodity Week with a review of the week's markets at 8:30 in the morning, all on WHOW, AM, FM, and streamed online.
Your friend in Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube. Brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. Paul Skowron is the CEO of Warner Hospital and Health Services. My guest in studio this morning. Paul, how you doing?
Seth, wonderful. How are you?
The humidity is gone temporarily.
Right.
And oh my gosh, I can breathe again. I'm not sweating every time I take 3 steps outside. It was a glorious morning. It really was.
The best we've had in a number of weeks.
I would agree with that.
I don't know how long it's going to be around, but I'm really going to enjoy this weekend.
Just enjoy the bejesus out of it for sure. Absolutely. Well, Paul, I'll tell you what, let's dive into here this morning. Let's dive into, I know you and I caught up back in, I'd say mid-June. This big, beautiful bill was on the table, and the president had a 4th of July deadline. He wanted it passed, and I think a lot of people thought that was rather aggressive and may not have come to fruition by that deadline, but I'll be darned if it didn't. And so here we are, and a lot of the conversation around it has been impacts of the of rural hospitals like yourselves. Just kind of give us the overview, the rundown of this bill, and again, how it impacts you, and we'll kind of go from there.
So the bulk of the big, beautiful bill regarding healthcare is effects on the Medicaid program as opposed to Medicare. And we'll get to the Medicare part later. But on the Medicaid, the part of the bill that actually was enacted, there are reductions in Medicaid reimbursement that will be enacted starting in January 1 that will be spread over 10 years. And it affects all hospitals, but it affects hospitals differently based on what is your total percentage of Medicaid patients compared to your total. And so specific to rural hospitals, there are many rural hospitals that have a high Medicaid component. Warner Hospital does not have a high Medicaid component. 20% of our patients are Medicaid. And so
given the overall Medicaid enrollment in Illinois, that's pretty surprising. I would say.
I know, isn't it? And but we're 45% Medicare. So think about that.
Now, Medicare is the federal program.
It's the people over 65 years old. Medicaid is a federal program.
Oh, Medicare is the state program.
No. Both of them are federal programs, Medicare and Medicaid. It's just that state by state, there was a different subsidy level, and Illinois had a higher, in the years past, we accessed the Affordable Care Act so that more people in our particular state accessed Medicaid than some states like Arkansas that did not access the Affordable Care Act. So there is concern amongst all of the healthcare industry, and in Illinois, across the United States, but in Illinois specifically, in states like us, who had access to more of that Medicaid federal assistance. So in rural areas, in metropolitan areas that have that are safety net hospitals in poor neighborhoods that have very high Medicaid populations, it's actually devastating. And in some rural areas that have high Medicaid populations. So who would that be? Think about more southern Illinois hospitals that have very few employers in their neighborhood. There is a couple of cities that rely on a prison as their major employer. Warner Hospital is very lucky. I've always called us rural light because we have decent-sized metropolitan cities to the north, south, east, and west. Bloomington, Normal, Decatur, Springfield, Champaign. And so many of the people that live in DeWitt County are employed at State Farm or Caterpillar or at Illinois State University, Millikan, ADM, and so forth. And so all of those folks have good insurance. They're not on Medicaid or Medicare. And that's why I call us rural light.
Gotcha.
We are only 20 to 40 miles from any of those cities. You go south of I-70 all the way down to Marion, Illinois, and those are really rural. Like in Robinson, Illinois, it's 75 miles to the next healthcare facility. They have a lot of Medicaid, and they're on a list of hospitals in the state that could really be materially impacted. Warner Hospital is not one of those, and so both of our senators have sent a letter to every hospital on July 25th. Both Senator Durbin and Senator Ducksworth saying this bill is out, and we would like you to tell us what is the projected financial impact for the next year, 3, 5, and 10 years. And honestly, it's about a 4% negative impact. It's not a financial loss. It just reduces our profit, our gross margin, by about 4%. We can manage that. There won't be any reduction in services. But it's a good exercise for us from a budget standpoint and projecting how we're going to spend our money in the future. And so I said, this is a good time, not just to look at next year's budget as we're already doing, but let's look at the capital expenditures for the next 3 years. Let's look at all of our outside contracted services like radiology readings and emergency room and lab services, anything where we're spending money that we don't have the services locally. Let's look at all those contracts and make sure we're getting the best service that we can. So it's a very good exercise to go through.
Sure.
But I am not concerned about the financial impact to Warner Hospital.
Got it. Interesting stuff. Now, so I've heard, kind of both sides of this. The one side says, so many Americans are going to lose their health care coverage. Others are saying, well, there's a buffer for that. And I wonder if this is the Rural Health Transformation Program. Do you know much about that? Is that buffer maybe they're referencing?
Yes, there is actually a $50 billion bucket that was put aside to assist rural hospitals that are going to be materially negatively impacted. I don't think we're going to need to tap into that, but there are a lot of rural hospitals, as I said, not just in Illinois, but think about Kansas, Nebraska, these outpost rural hospitals that are 50 to 70% Medicaid. They will need to tap into that fund.
Absolutely. Paul Skowron is the CEO of Warner Hospital and Health Services, our guest in studio here for this morning. How much have you been able to do that deep dive into the 1 year, the 3 year, the 5 year expenditures, the capitals, the capital improvements, all those things? How much of that do you have underway, and what are you finding as you take that process on?
I'm just looking at the capital expenditure plan for the next 3 years and looking at every line and rethinking it. Some of the expenditures are absolutely capital replacement issues for the foundation of the hospital, HVAC, cooling, all the things that we planned already. But is there anything? It's a good time to say, are we planning to replace it with the most efficient technology available? IT services. And of course, as you know, we've been talking about our electronic health record plan that will go live November 1. All the AI features that are being talked about with Meta and all the other companies, are we going to implement the best services, not just for next year, but for the next 5 years? Just yesterday, the president was on TV talking about how he's working with all of those big tech companies to have portability with your electronic health records across all systems. And we want to make sure that the company that the Meditech Expanse system we're using will be interoperable and portable with all the other electronic health record services across all hospitals, because we have a lot of partners locally, OSF, HSHS, Carle Health, all the large systems that have a different system than us, we want to make sure that we have portability so that our patients can go to all those different systems for specialty care that we don't have, and their healthcare information will transport easily.
How will this bill impact that state reimbursement piece?
That is specific to Illinois.
Yeah.
And that is the part that and the governor has said he needs to look at he did look at the state budget with that in mind, because perhaps 2 years ago it wasn't anticipated that there would be reductions in Medicaid reimbursement specific to Illinois, and so it does affect the state of Illinois, and they have to plan appropriately for future Medicaid services. You know, federally, they talked about immigration and how certain states like Illinois, specifically Chicago area, has a lot of immigrants and maybe illegal immigrants that were getting healthcare services paid for by the state of Illinois. So the governor and the Springfield legislature has to look at the reality of cutting back on services in areas where illegal immigrants had been accessing healthcare, and they're doing that.
Do you see much of that around here?
I don't.
Yeah,
I don't see much of that.
At least not in Clinton. Yeah,
not in Clinton.
Yeah.
Not in DeWitt County.
Well, and then my next question is, with that in mind, will that impact? Will it impact DeWitt County residents at all that come to Warner Hospital? I mean, in terms of their availability and access to services and healthcare and all those things?
No. A trickle-down effect that was considered for some rural hospitals that have high Medicaid components is if those patients don't have Medicaid insurance, will they then start coming to the emergency room like the old days and getting free uncompensated care? In those areas that have high Medicaid components, yes, that may be in effect. But for us, 0.001 of 1%, just a negligible impact to our emergency room services.
So this overall, this sounds very minimal, if any, impact on Warner Hospital.
That is correct.
Yeah.
So remember, I said 45% Medicare. What I'm looking at is the fall session where I'm starting to hear rumblings about looking at the Medicare program for an area where there can be some cuts. This is where I'll be rallying the troops and the AARP folks and so forth to affect the legislature in Washington, D.C., because when all employees get paid, and there is a Social Security tax, correct? Mm-hmm. In that Social Security tax that comes out of your pay, there is a Medicare component. Mm-hmm. We pay for Medicare services. Mm-hmm. So when I hear that some of the Medicare patients that have a pharmacy component, if they don't have a secondary insurance, there may be some reduction in the pharmacy benefits for low-income Medicare patients. I'm on top of that. I want to make sure that our senators are working on that in advance.
Yeah, so getting ahead of it.
That's correct.
Yeah, for sure. Anything else on this, Paul, we didn't touch on?
No, sir.
Very good. Paul Skowron is the CEO of Warner Hospital and Health Services, my guest in studio. More to come with Paul on the morning show on WHOW.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this Thursday. Jim Taylor, RFD Radio Network. Corn starting today slightly lower, beans lower, and wheat also in the red. September corn opening $3.91.5 down 1/4. December corn down a penny, $4.11 1/4, and March corn $4.28.5 down a penny. August beans starting today $9.64 3/4 down 3. September beans down 3, $9.72 3/4. November beans $9.92.5 down 3 1/4. September wheat opening $5.21 3/4 down 2 pennies. December wheat down 2 1/2, $5.41 3/4. March wheat $5.60 3/4 down 2 1/4. August bean meal $2.60.20, that's down 50 cents. And August bean oil $56.05 down 45 cents. The opening numbers at the Chicago Board of Trade on this Thursday morning. Jim Taylor, RFD Radio Network.
Is the summer heat getting to you? This is Scott Baum from Baum Chevrolet Buick in Clinton and Farmer City, inviting you to cool down in a new Chevy. We have cool new crossovers like the Chevy Equinox or hot new trucks like the Chevy Silverado 1500, which has up to $7,500 in extra savings over our regular discounts. See all our inventory and prices online. And don't forget, we need and would love to trade yours in. Chevrolet, together let's drive. BaumChevyBuick.com, right from the start.
CEO Paul Skowron here from Warner Hospital and Health Services in Clinton. Call our family medicine clinic now to get your children's school physicals scheduled. We're accepting new patients of all ages. More info by clicking our icon at DeWittDailyNews.com.
DeWittDailyNews.com is the area's leading local news source 24 hours a day, 7 days a week. Get the latest local news, obituaries, police blotter, weather forecast, and more. Head to DeWittDailyNews.com to get the local information you need to know.
The Big 1520, WHOW Clinton, along with 92.
Your friend in Central Illinois, WHOW.
Once again, good morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest in studio this morning is Paul Skowron, CEO of Warner Hospital and Health Services. And Paul, as we chat this morning, some changes out of your foundation. I know for a few years there, Kurt Homan was leading the foundation, but he has gone full-time with the DCDC. And so I'm sure that's meant he's not been as focused on the hospital foundation. What's the latest? What's going on there?
Yes, Kurt did such a good job helping the foundation with so many fundraisers over the last few years. But now he needs to focus entirely on the Economic Development Council because there's so much going on over there. And so as a result, we have a new chairman of the Warner Hospital Foundation, and that is Christy Hobby. The dentist in town, and she's really doing a great job. But we have been struggling with, do we need to replace Kurt as an executive director?
Mm-hmm.
And to be honest, we have been running on his coattails and using all his cheat sheets on how to prepare for things like our next golf outing and our next bingo event. And so far we've been able to organize things and just call Kurt and say, we're missing something here. How do we do this? And he's always there to help us.
Sure.
So as a result, what Christy and her new hospital foundation, she's got a lot of new volunteers on the foundation. And what she's been able to organize is that on September 12th, we will have our golf outing out at the country club in the morning. And on November 14th, we will have bingo. That's a Friday, November 14th.
Oh, man, Friday bingo.
Yeah. Now, think about that. The last time we had bingo, it was super successful, and it was at Circle South, but that's been closed, right? So we had, what do they call that? Glow bingo. And it was a big event. Speakers and lights and all that kind of stuff. Computers to call the numbers. We're going to go back to the old-fashioned bingo where somebody's going to be calling out the numbers, and that's going to be me. And we're going to do it at the American Legion. And Tom Reddington has helped us put this together for November 14th. So I'll remind you each month about this, but it's going to be sort of old-fashioned bingo. I think it's going to be a lot of fun.
Yeah.
Tom will provide the food and drinks and so forth.
I mean, bingo's bingo. People will come out if it's glow or not.
I'm telling you.
Yeah, they love it.
Yes.
They love it. Very good. So you said November
14th is a Friday night.
All right.
You try to find the right spot, and you want to get it before people get really into the holidays. So that's what we're trying to do here is before they get so busy with shopping and the Thanksgiving and Christmas, let's get that pre-holiday event in. And if it works well, we'll do it again in February.
Yeah, very good. So look forward to that. Between that and the golf outing, Dr. Hobby's got a lot on her plate right now, it sounds like.
Indeed, she does.
Yeah,
She's got a lot of energy. So
and that's what you want out of the foundation, right?
That's
or to
right.
someone to lead the foundation is that energy and enthusiasm.
so organized.
Yeah. How much has that foundation helped the hospital, Paul? I mean, it feels like it's been a while since we've heard about the foundation.
Boy, go all the way back to the 3D mammography unit that was installed because of the hospital foundation back when Dixie Walden was running the foundation. And
thinking about her the other day, in fact, actually. So
she did so much for the
she
hospital.
did.
It was
she
incredible.
did. Yeah.
She was actually one of the founders of the foundation back in '98.
Mm-hmm.
So there was the 3D mammography, and then totally re-outfitted the physical therapy a couple of years ago. Emergency room chairs, modernizing those for emergency transport for patients. So you can go department by department. Cardiac therapy. The hospital foundation has contributed in all these areas.
And they continue to support you.
That's correct.
And they do scholarships, if I'm not mistaken.
Every year there are scholarships. There's 4 or 5 scholarships awarded to the students, high school students of the area that have professed an interest in healthcare in the future.
Sure. Has that paid dividends, have you found?
Yes.
Yeah.
There's some of them that went to medical school, and we've interviewed them. They found other opportunities, but local opportunities, and we stay in touch with them. So
yeah,
we always hope someday they're going to come back to us.
That's the idea. That's the idea for sure. Very good. Paul, about 2.5 minutes, my friend. What did I not touch on you want to put out there for us today?
Our walk-in clinic is busy with, as you said, heat-related items that cause people to be nauseous and so forth, and summer-related conditions. But we also want to remind everyone about family medicine being there for those school physicals. Tomorrow is August 1. School starts in late August. So there's a lot of folks that they're just coming off vacation and they haven't arranged for those school physicals yet. So they need to call family medicine and arrange for those school physicals.
Very good. So do that now. And as we think about the start of school, Paul, I don't know if you're at liberty to talk about this, but things we can do to be, preparing our kids for a healthy school year. I know for our kids, they take some vitamins. I'll probably start getting them back on those here in the next week or two. What should we be doing with our kids to make sure it's a healthy school year for them?
Vaccinations. I still believe in vaccinations.
Yeah.
The basics, the MMR and stuff like that, measles, mumps, rubella. We want them to be safe. There are families that have children that are their immune systems are more subject to diseases than others. So they should be looking at whatever is specific to those children, whether it's flu shots that aren't mandatory, but if their people are subject to those kind of illnesses, and this is the time to start thinking about how to prepare your children from a health standpoint. And they really get worn out in the summer. The active kids, they pick up a lot of stuff. So it's just time, probably a good time for an overall physical for their kids, not just for the shots and so forth.
Very good. All right, Paul. Well, always good to talk to you, sir. What's the best way for folks to learn about all things Warner Hospital?
Our Facebook page is very popular, Warner Hospital and Health Services.
Paul Skowron, CEO of Warner Hospital and Health Services, my guest in studio. The morning show streams to Facebook and YouTube, brought to you by Peterson Insurance.
News this hour from townhall.com. I'm Rich Thomas. Canada joins a handful of Western countries announcing conditional plans to recognize a Palestinian state. The Canadian Prime Minister making the announcement.
Citing the expansion of settlements in the West Bank and